Dyspepsia is basically also termed as indigestion, and a lot of patients usually suffer from dyspepsia, which is basically an associated symptom with the abdominal pain. It's a very major feature. A lot of diseases are basically ruled out or even ruled in when you are looking at a patient who's suffering from abdominal pain, and it is basically coupled up with the dyspepsia as well. Now, the patients of dyspepsia usually complain of heartburn, and it is a very important feature that you have to look for. It can be a patient of GERD, that is the gastroesophageal reflux disease, who usually suffers from basically an amalgam of all of these conditions or all of these symptomatologies. For instance, belching. Belching is basically the reflux phenomena that the patient is suffering from. Bloating is basically the gaseous content basically increases in the abdominal cavity, and that is basically regarded as the bloatement of the abdominal cavity. Nausea and vomiting are usually the suggestive factors along with all of these set of signs and symptoms. Now, when a patient has this particular history, these set of signs and symptoms are present in the patient, you're looking usually at a patient who's suffering from peptic ulcer disease, or either it is a patient of gastroesophageal reflux disease. Usually it can be even a non-ulcer dyspepsia. So you're ruling out the ulceration, you carry out the endoscopies, and you get to know that the patient is not suffering from an ulceration. Then you would be suggestive of the fact that he has a non-ulcerative dyspepsia that he or she is suffering from. Physical examination is the same for all of these conditions, and the treatment depends upon the etiology. Sometimes it is an H. pylori related dyspepsia. So you carry out the H. pylori infective tests. You can give a particular regime to the patient, and the treatment is done accordingly for the particular patient. It can be even the diet controls or the diet managements that can be regarded for these particular patients who are suffering from peptic ulcer disease or the GERD. So these are the particular differentials that you have to keep in mind when you have these patients of dyspepsia.